Hi, my name is Melanie and I work in the intensive care unit as a nurse at Spring Hill Medical Center. I take care of critically ill patients, whether they are recovering from surgery or they've had a cardiac arrest or patients that are on the ventilator. Basically any patients that need critical care attention. My role as a nurse in the critical care unit is I take care of patients after surgery, most specifically patients that have had open heart surgery. So we get them after surgery and recover them, which includes getting them off the breathing machine. We do medications like IV drips to control their blood pressure and give them sedation and pain medicine. And then when they're better, we send them out to the floor. When we get a patient into the ICU, I hook them up to the monitor and we take their vital signs. We also draw blood on them, put an IV in them to get IV access so we can give them medications as needed. We send our blood to the lab, and based on the results, if there's anything abnormal, we have to call the doctor and let them know what the results are. If they give us any orders, we have to carry the orders out, whether it may be if their blood count is low, that we might have to give blood transfusions, or maybe if they're in respiratory distress, which means they're having a hard time breathing. If the lab results are abnormal for that, we might have to bump up their oxygen. And just closely monitor the patient to see how they're responding to the things that we are doing to them. If you have a patient that is unable to eat or drink, we have to put tubes in their nose or even in their mouth sometimes. It goes down to their stomach, and that's how we feed our patients for the people that cannot eat. Other things or other patients that we have to take care of, maybe if the patient is on the breathing machine, we assist in doing oral care. You clean their mouths out so that they don't get dry, because if you can imagine, if you don't have anything to eat or drink, that your mouth gets very dry. So we clean that out. If the patient, maybe their breath sounds do not sound well or their oxygen level's low, we have to stick a little tube down there, the trach, or not the trach, but the ET tube is what we call it, the little hose that goes in their mouth to their lungs. We have to stick a catheter down there and suction their lungs out so that they can ventilate better or oxygenate better. Other things that happen usually with a patient that's on a ventilator, as we talked about the feeding, that they have to get feedings. Also that we have to bathe our patients. We also, if they have to have a catheter also put in to help with urination, and if they have a bowel movement, we have to clean them up for that too. Sometimes we have to give enemas if they're constipated, or enemas if maybe a lab is out of whack. We have to give them a medication to help lower the lab value. Another important part of our job is computer charting, so you need to be computer oriented. We have to document all the things that are going on with our patients. We have to document that in the computer, so it needs to be accurate. And we spend probably a good portion of our day charting on the computer. I typically work 3 shifts a week, which are 12-hour days, so I work 36 hours a week. The stress level, it just kind of depends on your patient load and their needs. I mean, sometimes it can be very stressful if you're taking care of a really critically ill patient that's unstable. Maybe they're on a breathing machine. You have to require tube feedings, and they're maybe having frequent bowel movements, or maybe the patient continues to have cardiac arrhythmias or heart problems that make the patient arrest. So it just kind of depends on what's going on with the patient, depends on basically how much stress level that you have. And another thing that plays a big role in nursing is having good team players. I mean, if you want to be a nurse, you need to be a good team player, because that also not only benefits you, but also benefits your patients and the other people that you work with. If you would like to be a nurse, the requirements are a 2-year degree, which is an associate degree, or if you would like, you can go for the 4-year degree, which is a bachelor's program. I personally would recommend the bachelor's program over the associate degree, but you can do either. Both of them, you would be able to work as a nurse. You would do the nursing program, and at the end you would have a board exam called the NCLEX, and you take that, and after you pass it, you can have a registered license, which we renew every 2 years. Some additional training you can receive on the job. If you work in the critical care unit, most hospitals require you to do a critical care class, which they provide. And it's usually about a 3 to 4 week class that you go to, and they train you on different line insertions and how to take care of things like that, and recognizing EKGs and how to take care of patients that are on the vent or things like that. Another requirement is for everybody you have to have your basic life support or BLS, but if you work in the ICU you have to have your ACLS, which means that you can give life-saving drugs. If someone were to arrest, that we have a line of drugs that we give. We also sometimes have to shock people, so that's another thing that you can do with your ACLS. If you only have your BLS, you have to allow the monitor to determine the rhythm, and then it will tell you if you can shock or not. If you have your ACLS, you can determine it yourself by looking at the monitor. Other things, if you work in the critical care, obviously, like I said, you need to be a good team player. You need to be able to help out your colleagues so that y'all can provide better care for your patient. Being detailed oriented. If you work in the ICU, you need to be detail oriented. You need to know what's going on with the patient, their history, things that have happened to them in the past may portray some of the things that are going on with them now. So you need to pay attention to things like that.
Go.
The best part of my job is taking care of patients and seeing that something that I've done has helped them get through the process that's going on with them, whether it may be that they've gotten better and we're able to go home, or even if they died while they were at the hospital, maybe I helped them with their last wishes and taking good care of them, and helping their family and comforting them. Some of maybe the worst things, or the things that I don't really like or that other people might not like, is secretions. A lot of people have issues with suctioning trachs or suctioning people that are on the ventilator, cleaning up bowel movements. Nobody likes doing that, but obviously it has to be done. The other things that may be more emotionally hard is, like I said, taking care of patients that are dying, because not only you're taking care of them, but you're taking care of the family too. And a lot of times that's emotionally difficult, and especially for the family members, they have a hard time dealing with that. And sometimes it's a good experience, and sometimes it's not. The best advice I can give you, if you're interested in becoming a nurse or you feel like you might be, some things that you could do is maybe shadow someone that works in the field and kind of follow them around for a day or so and see if that's the kind of things that you would like to do, because you might think that you like it, and then after you see it in work, that maybe you don't think that is for you, because you definitely want to like your job so that you'll enjoy it and you'll be happy, because that's the important part of being in any career, is being happy with the decision you made. Other things that maybe you could do is you could work as a care tech, and we have those here, and they take care of patients as far as they take vital signs for us. They help them with their daily activities such as bathing and helping them to the bathroom. So if that's something that you could do to kind of see if maybe nursing is something that you would enjoy.